It's lunchtime. It's lunchtime.
Amanda Furge didn't expect to be a mother to 3 boys in her home state of Mississippi.
I didn't even plan to have kids.
She grew up poor and a preacher's daughter and faced sexual abuse as a child.
I knew as I was maturing, I had to get away. I had to get away as soon as I could.
She eventually made her way to Chicago and was in her early 20s when she got pregnant. But Furge wasn't ready to be a parent. So she sought out abortion services. The process in Illinois was simple.
It was just adding to the relief to where all I had to figure out was how did I feel emotionally, which is all you should have to worry about. Did you tell it?
A few years later, Furge found herself back in Mississippi with her 1-year-old son, Titan, pregnant again and trying to escape an abusive relationship.
If this person is abusing me like this for the children, that just means danger.
This time, trying to get an abortion in Mississippi was much harder.
Everything.
Restrictions to abortion access in a place like Mississippi affect women of color disproportionately. About 74% of women getting abortions in Mississippi are Black, compared to 38% of residents in the state. Nearly every morning, outside the only abortion clinic in Mississippi, protesters gather to voice their opposition.
Ma'am, think about it. This is murder.
Some try convincing visitors to go to a crisis pregnancy center instead, where women are offered pregnancy tests, sonograms, and baby clothes.
All of them exist to support, for the purpose of supporting women making these decisions and supporting them in the effort to choose life.
Republican Andy Gibson pushed for the 15-week abortion ban when he was in the Mississippi legislature. He says women who choose to deliver babies are well cared for.
Whether it's counseling or whether it's medical care, whether it's financial resources or food, in fact, there are networks of support here, both at the private and at the governmental level.
These resources that they speak of, where are they? If they're out here, where are they?
Shannon Brewer heads the abortion clinic in Jackson. She says the type of support many women of color who seek abortions need is structural: access to quality health care, decent pay, child care, and education.
These same people who are voting to get us closed down are the same people who are voting to cut these things out. These are the same signatures. This is a direct attack on African American, Black, and brown women.
When Furge tried to get an abortion in Mississippi, she ended up at a crisis pregnancy center, thinking it was a clinic. After keeping her waiting for hours, a woman at the center asked to see pictures of Furge's son, Titan.
We're admiring my baby, and then she says, no, what if I just killed him? Now we're coming out of this moment of I've been waiting for hours. You don't know what's going on in my life in the background. You get me here and looking at my baby. I'm nursing, you know what I mean? And she says, what if I just killed him? And in that moment, you just feel like you're in danger. What? Where am I? What is going on here?
By the time she found the abortion clinic, it was too late.
I knew I was gonna have to have a baby because it dawned on me. Look at where you are. Look at where you live. Look at the people in positions to either help or hurt, and look at what they choose to do.
Red, orange, yellow.
That baby, Mega, is now 7 years old. Furge says she loves him and is happy to have him in her life. But the frustrating experience made her more outspoken about the difficulties Black women in particular face in controlling their own reproductive choices in conservative states like Mississippi.
We are the ones dying. We are also the ones having a struggle to live. So which one do you want? Who can we be? Like, how can we show up in the world?
Nori Nasser, The Associated Press, Jackson, Mississippi.